complications of middle ear infection. Infection of this part is called otitis media. If the duration is short, it is acute otitis media. If duration is more than 3 months, it is chronic otitis media. So, infection can spread from this part to surrounding areas. It's more so common in case of acute otitis media. So, this middle ear, which has a 6 wall structure, all the side is surrounded by bone. Just imagine me, I am standing on the right side middle ear. So this side right ear, right side middle ear. To my right side is a eardrum, left side is an inner ear. In the front, I have a tube which goes to the nose, which is called the eustachian tube. And behind me, I have an air cell system called mastoid air cells. All this surrounded by bone except on the right side, which is the eardrum. And above, roofing, I have a bone covered. Above that, we have the brain. Left, I have already mentioned, inner ear. Beyond that, I have the brain again. And floor, you have a bone. Below that, you have a vein. So these are the structures of the middle ear, and all the sides except on my right side, all the other sides are covered by bone. So the middle ear infection can spread to any part through the bone, or through small veins, or through small defect which is caused because of trauma or because of a surgical wound, and it can even spread through areas or space around the arterioles. This is the route of spread. So is this infection common in all the cases? No. It's more prone in certain cases, especially so if the age is less, and in immunocompromised patients. And diabetes comes one among them, diabetes mellitus. And if the virulence of the organisms is more, the complication rate also increases. So when the virulence is more, the efficacy of the medication, the treatment becomes less also. So all this can result in complication. Now, we will go through different complications. So first, before, let us classify the complications. So if you have a look of this skull, this is the ear, this is the ear, and this ear is seen in the bone, this bone which I am marking, these lines which you see. So this is the temporal bone. So ear is in the temporal bone, the external ear, middle ear, inner ear is seen in the temporal bone. So infection here is a temporal bone infection. That is external ear, middle ear and inner ear. So anything outside the temporal bone is extratemporal. This extratemporal can spread inside where you have the brain. So it becomes an intracranial complication, or it can spread outside, which can be extratemporal extracranial complication, which can spread to the face or to the neck. So each complications, let us have a look. But please bear in mind, this video is just the names of the complications alone. So each complication which I am going to mention, it has been taken in detail. You have a separate video for that. So you want to know in detail, please refer to those videos. So coming to the temporal bone infection first. So just like I told you before, I am standing on the right side middle ear. So inside the middle ear, you have 3 small bones. So possibility of these small bones being eroded, it results in hearing loss. And just next to that, you have a nerve. There is a facial nerve which supplies the face. So if there is damage or involvement of the facial nerve, it results in facial nerve palsy. So that is about the structures in the middle ear. Now, when the infection spreads behind, which is called as a mastoid system, this is how it looks like. This is the middle ear. Just behind the ear, you have a mastoid air cell system. So when you have infection there, it gets filled up with pus and it erodes the mastoid bone too. So the complaint will be, the child will have a swelling behind the ear and this pinna is displaced forwards. So this complication is called as mastocytosis. Now let us see the complication if it goes medially, this side, that is to the inner ear. So inner ear, you have inner side, you have two structures. One is a labyrinth, other is a petrous bone. So labyrinth, which is the inner ear, it has got two functions. One is hearing, one is balance. So when you have labyrinthitis, infection of the inner ear, it results in loss of hearing, which can result in a dead ear too. And the patient will experience severe vertigo, giddiness, which can last for a long time. So that is about labyrinthitis. If the infection spreads still further, say for like this is a ear, this is a temporal bone, it goes inside and it comes to this part. This part is called the petrous part of the temporal bone. Here you have a small nerve, it goes to the eye. It goes to the eye here, just behind the eye. So if you have the infection here, it is called petrositis. So this will result in three complaints. One is the patient says that whatever he sees, he'll see as double, diplopia, double vision. And second is, he'll say there is the eye pain behind the orbit, behind the eye, retroorbital pain. And along with that, you have a ear discharge. When you have these three complaints, we are sure the infection has spread from the middle ear to the petrous part of the temporal bone and he has got petrositis. So that is all about the inner ear complaint. It is spread medially. So posteriorly we have seen, medially we have seen. Now, we will see the extratemporal. That is, first we will see the cranium. This is a picture of the ear. Just above that, this part, this is the brain. Brain is covered by a thick covering called dura. And if there is pus outside the dura, it's called extradural abscess. If it spreads inside, it's called subdural abscess. And if it spreads still inside the brain, it's called the brain abscess. And in case the dura is involved or the coverings are involved, it's called meningitis. That is intracranial complication. Next, let us see extracranial, extratemporal. Suppose it involves the face. So, before that, one more point to be mentioned. There is a big vein which flows behind the ear. So if there is infection in the vein, it's called thrombophlebitis. And the name of this vein is sigmoid sinus. Hence, infection of this vein is called sigmoid sinus thrombophlebitis. Now, extracranial complications, extratemporal of course. If the infection spread to the face in this area and it forms an abscess, it's called zygomatic abscess. Suppose it spreads from this mastoid. This is the mastoid. It erodes this mastoid tip and comes down to the muscle which is attached here. On the other side, inner side of the muscle, it tracks down. Then it is called as Bisol's abscess. So it will be here. Suppose after the erosion of the mastoid, it tracks down to this part. It is called as Sittli's abscess. So these are the complications of otitis media, which is more common in acute otitis media. The common presentations will be, of course, there will be history of ear discharge and slight ear pain, and the patient gets persistent fever, headache, ear pain, headache which is slowly increasing, and vision which is blurred, and he'll have a retroorbital pain, and along with that he'll have projectile vomiting. In the sense, usually when you have vomiting, you have a feeling of vomiting first, followed by vomiting. But when the infection spreads to the brain, you have a projectile vomiting. There will be no stage of nausea. He throws it out, whatever is there. So it's called a projectile vomiting. Likewise, there will be, along with this, you have severe vertigo, so dizziness also. If this condition at this stage is not taken care of, not treated properly, it still progresses further and it results in an altered sensorium with state of confusion. and he develops fits or seizures, and slowly he goes into a stage of coma. So these are the common complications and the way of presentations of complications of otitis media. So like how I mentioned, I have just mentioned the names of the complication. If you want to know the details of each complication which I have mentioned in separate video, please watch my other videos for that. Thank you so much.